Hi, welcome back. Adam Rosen here. Thanks for tuning in. If you haven't already, please like and subscribe so you get updated when videos like this come out. Today I want to talk to you briefly about carpal tunnel syndrome. It's something that a lot of people deal with. You'll see people rubbing their hand. They'll complain of tingling and numbness in their hand, and it's due to compression of the median nerve. So sit back. In today's video, I'm going to talk to you about what the carpal tunnel is, how we go about diagnosing it, and what treatment options may be available to you. Okay, so you might be asking, what is the carpal tunnel? And the carpal tunnel is a tunnel or a passageway in the wrist through which the nerve, called the median nerve, and 9 of your flexor tendons pass. And these are the tendons that allow you to flex your fingers. Now, the base of that, or the floor, are carpal bones. And the roof of that is a ligament called the transverse carpal ligament. And there is really no give in this ligament or the bones, which is why if you develop swelling, you can easily develop compression of the nerve within the tunnel. And what might you feel? Well, one of the first most common things that people will describe is night pain. They're woken up because the pain in their hand, tingling or numbness, wakes them up from sleep. People even during the day may note tingling and numbness of the thumb, index finger, middle finger, and just the side, what we call the radial side, or your thumb side of the ring finger, because the outside half of the ring finger and the pinky finger are controlled by another nerve called the ulnar nerve. So those are sort of the common findings: night pain, tingling, numbness. Now late, you might start to develop weakness in the muscles in the hand. You might find that you're dropping things or you can't hold things tightly. People also lose proprioception, which is the ability to discriminate between 2 points versus 1 point on your fingertips. And late, after the muscle weakness has been there for a while, people can actually develop visible weakening or smallness of the muscle. We call that atrophy. And those are late signs. And those are things that, if they occur, may not always get better with surgical intervention, which is why we look for symptoms early and try to treat this as early as possible to prevent those late symptoms from developing. Now, you may be wondering, are you going to get carpal tunnel syndrome? Are you at risk for developing this problem? And there are a few things that we know that may cause this in certain people. So there's a genetic predisposition based on your genetics, and how that carpal tunnel forms, if it's very small and narrow, may predispose you to develop carpal tunnel syndrome. More commonly, we see people that have certain jobs or hobbies and activities where they get repetitive motion of their hand and wrist or certain hand positions for long periods of time that can put pressure on the nerve and cause these symptoms. Even women during pregnancy tend to swell, and one of the areas they can swell is in the wrist and the carpal tunnel, and they can develop these carpal tunnel syndromes. Certain other diseases that may cause inflammation of the lining, or what we call the synovium of that area, things like diabetes and rheumatoid arthritis, can compress the median nerve. And another time that we see it are with wrist fractures. When people fall and break their wrist, there can be a lot of bleeding and bruising and swelling in that area, and people may develop an acute carpal tunnel syndrome from the swelling related to their fracture. Okay, so now you think you have it, and you show up at our office. So you're wondering, how do we diagnose carpal tunnel syndrome? Well, first and foremost, we take a good history. We want to know from you as to what symptoms you're having and how long they've been present, and what things you might be doing that are aggravating it. And then we perform a physical exam. One of the first tests we typically do is what's called a Tunnel's test, where we basically take our finger and tap on the area of the carpal tunnel where the median nerve is to see if it sends like a shock-like or shooting-like sensation into your fingertips. This is basically like hitting your funny bone, but instead of that pain or symptom going all the way down your arm, we're looking for it specifically in the fingers of your hand that are controlled by the median nerve. Another very classic test is a test called a Phelan sign. This is a reverse prayer position, and it's compressing the median nerve. So if you show up in the office feeling pretty good, and you put your hand in this position for a while, it should reproduce the symptoms. Sometimes even a reverse Phelan, or what's called a prayer test, is done. One of the other things that we're looking for too, like we talked about before, is loss of sensation or 2-point discrimination, we call proprioception. And we'll commonly just use a simple paperclip and ask you with your eyes shut to know whether or not we're touching your finger with 2 points or 1 point. And the other thing we're looking for is atrophy. So we're looking at the muscles and seeing whether or not some of the muscles in your hand, especially around your thumb, have begun to atrophy. And when we test whether or not those muscles or that hand is weak. especially compared to the other hand if that hand is normal. Now, occasionally beyond that, we might want other tests. So we might order a test called an EMG or nerve conduction velocity test. And this is where we can test the nerve itself to see whether or not it's damaged and how severely it's damaged. But also, we want to check and see whether or not there's compression at the level of the elbow or the shoulder or the neck, because all of the symptoms may not be due to compression only at the wrist. So we want to see where else the nerve has been damaged. And then there's a few other tests that occasionally are ordered, things like ultrasounds, x-rays, or MRIs. Okay, so now that you've been diagnosed with carpal tunnel syndrome, what do you do? So there's a bunch of non-surgical treatments, and then I'll cover the surgical options. So non-surgical things that we can do are using splints. There are night splints, or you might even use a splint during the day if your job requires certain wrist positions that are aggravating your symptoms. And sometimes, of course, anti-inflammatories, things like ibuprofen or naproxen, can be helpful to reduce the inflammation in and around the carpal tunnel. Certain activity changes are important. So if you do have an activity that is aggravating the symptoms and there's a way to go about changing how you do that activity or refraining from the activity for a period of time, that might help improve or lessen your symptoms. There are a number of exercises that you can do. So stretching exercises that you can do to stretch the tendons and the nerve, and I'll put that link in the show notes. There's a whole bunch of exercises that you can do, both by stretching the whole arm, as well as certain exercises that you can do to stretch the fingers and move the hand in a certain way that help increase the tendon glide. And one of the last things that we might do if those things fail to improve your symptoms is to do a cortisone injection into the carpal tunnel, again, to reduce the inflammation around the nerve and the tendons that are being compressed within the tunnel. Now, if those things do not work, sometimes surgery is recommended. And there are two basic types of surgery. We can do an open procedure where there's a small incision made at the wrist crease that allows us to go down and identify the transverse carpal ligament and cut it. And if we cut it, it opens up the tunnel, which relieves the pressure on the median nerve. At other times, some surgeons do what's called an endoscopic procedure where they make two smaller little incisions and they put a camera like you'd have an arthroscopy for your knee to look inside the tunnel, and through the other portal they'll use a little blade to release that transverse carpal ligament. Now, most of the time the recovery is pretty simple. The pain is usually mild to moderate, and most people find over the ensuing months that their tingling, numbness goes away, the strength improves. One of the most frequent first things that people will see if they've had night pain is the night pain goes away. That usually is almost automatically. But we want to catch this early, because if you wait until the symptoms are severe and you've developed severe numbness and severe atrophy, even releasing the transverse carpal ligament may prevent the symptoms from getting worse. But you do not always see a complete resolution or improvement in the symptoms if they're severe and they've been there for a long time. Well, I hope now that you understand what the carpal tunnel is and what carpal tunnel syndrome is and what the symptoms are that you might have if you suffer from carpal tunnel syndrome, and more importantly, what treatment options are available to you. So be sure to check the show notes, because I'm going to put a link in there to the home exercises that you can do. And if you are thinking that you might have carpal tunnel syndrome and you're having some of these early symptoms, be sure to get checked out by a doctor so they can determine whether or not more aggressive treatment might be necessary to prevent the problems from progressing. Thanks again for watching. I'm Adam Rosen. Until next time, stay safe.